Today's topic are unusual mosquito vector diseases that we have seen an increase in 2024 in the United States. The topics that we will cover, the disease states, are West Nile virus, which was in the news as a very famous researcher was hospitalized. Anthony Fauci was hospitalized with West Nile. Dengue fever, which my experience with that was when I was in India, and the importance of protecting yourself from mosquito bites, and then Eastern equine encephalitis. So those are the three topics that we'll cover briefly today. Here is the vector, the mosquito. We all know what they look like. We all know how to avoid them, and we need to do better as far as avoiding mosquito bites when at all possible. The first one we want to talk about are West Nile virus human cases in 2024. And if you look at the map, the darker areas, they're having more cases than the rest of the country. But all areas, for the most part, with the exception of parts of Middle America and the Pacific Northwest, have not reported cases. There have been 216 cases, which includes 142 cases of neuroinvasive disease as of August 20th. These cases have been reported in at least 31 states, with Texas, Louisiana, Arizona, California. All those areas are being hit harder, as I just mentioned. The symptoms can range from mild flu-like illness, and you'll see that with all of these diseases that I'm talking about, to severe neurological conditions, and we definitely want to avoid that. The vast majority of people infected with West Nile do not experience any symptoms. About 1 in 5 may develop nonspecific flu-like illnesses. Incubation period can range from 2 to 14 days, and the transmission season is from July through October. Mild disease would have fever, headache, body aches, rash, nausea, loss of appetite, and swollen lymph nodes. Severe disease is high fever, severe headaches, stiff neck, confusion, muscle weakness, seizures, vision loss, and paralysis. So it really is important to try to avoid this. And as I mentioned earlier, some famous people are being put into the hospital because they are coming down with severe disease. People who are more likely to get severe disease are going to be older people, or they're going to be people who are immunocompromised. The next virus we're going to talk about is dengue virus infections in the United States, a report that came out from the CDC. They actually sent out a health alert network, health advisory related to the increased cases of dengue fever in the Americas. It's a nationally notifiable disease in the U.S. It resurged globally after the COVID-19 pandemic, and these numbers that I'm getting ready to share are a little bit on the frightening side. In 2023, more than 4.6 million cases and 4,000 deaths were reported in the Americas region. As of June 24th, 2024, more than 9.7 million dengue cases have been reported in the Americas, twice as many as in all of 2023. So again, something that we're seeing a lot of. And you can look by jurisdiction. You can see that Florida, California, Illinois, New York, Massachusetts, those cases are at the highest level, especially Puerto Rico, when that's because we've had remarkably warm temperatures and some remarkably wet areas. So this gives you the idea where it is. I live in Georgia. We are seeing some cases, the same as in Texas, New Mexico, etc. So this is a national disease. Even some cases, as 1 to 4, there are only 3 states, that haven't reported any cases. And that could be due to just their reporting systems. The symptoms, the mild disease begins after an incubation period of 5 to 7 days, and there are non-specific signs and symptoms such as nausea, vomiting, rash, muscle aches, joint pain, bone pain, pain behind the eyes, headache, and low white blood cell counts, which for the dental community is really important. When our absolute neutrophil count gets below 500, which is a part of the white blood cell count, we need to premedicate patients before invasive procedures. Now, if somebody is presenting with dengue virus symptoms, we're not going to be treating them in the first place, but just to give you a little bit of an addition. For severe diseases, the warning signs include abdominal pain or tenderness, persistent vomiting, clinical fluid accumulation, mucosal bleeding. And another thing, we look in the mouth. We always look at the soft tissue. We have a lot of mucosal tissues in the mouth, and we could see some bleeding. Lethargy, restlessness, progressive increase of hematocrit or liver enlargement greater than 2 symptoms. Severe disease with associated severe bleeding, shock, or respiratory distress caused by plasma leakage or end organ impairment develops in 1 in 20 people with symptomatic dengue. Eastern equine encephalitis virus can cause a febrile illness or neurological disease, including meningitis or encephalitis. There is no specific treatment for Eastern equine encephalitis. Rest, fluids, and pain medicines might relieve symptoms. For severe disease, patients might need to be hospitalized for supportive treatment, such as IV fluids, pain meds, and nursing care. People and horses are considered dead in host. And what that means is that if a person has Eastern equine encephalitis, they are not contagious. If the horse has Eastern equine encephalitis, again, they are not contagious. And that's what is meant by a dead-end host. The symptoms are febrile illness, fever, chills, body aches, and joint pain. Are you not seeing sort of the similar symptoms in these mild diseases, which is why if you start having fever, chills, and body aches and joint pain, please go to your physician to get checked out to see exactly what is the cause. This illness lasts 1 to 2 weeks, and most people recover completely when there is no CNS involvement. People over 50 years of age and under 15 years of age seem to be at greatest risk for developing severe disease when infected with this virus. The neurological disease can include meningitis and or encephalitis. Signs and symptoms of neurologic disease include fever, headache, vomiting, diarrhea, seizures, behavioral changes, drowsiness, and or coma. Only about 4 to 5% of human Eastern equine encephalitis virus infections result in encephalitis. So that's important. But it is something that we are seeing. And if you look at the states where this is presently showing up, so most of the states do not have this one, but it is one of those things we are seeing more cases of based on changes, at least this year, in our weather. I want to thank you for joining. Please subscribe to this channel for future updates and future diseases or conditions or things that the dental office can do to make sure that we stay healthy and our patients stay healthy. Thanks again.